China has begun delivering 2 million COVID-19 vaccine shots to Myanmar as a growing number of infections along the border spills into Yunnan. The first batch of more than 730,000 doses of Sinopharm has been flown to Yangon. Myanmar wants to vaccinate half its population by the end of the year, but as Young Wai-kit reports, that will be an uphill task.
A grim reminder that it's far from over. Thousands have died since the third wave of COVID-19 infections began in June, and Myanmar is struggling to cope with the pandemic. Even as Beijing sends the latest batch of vaccines, it'll be an uphill task for Myanmar. By August, the Myanmar army aims to have 6 million doses of vaccines, 2 million of which will be donated by China. Myanmar aims to vaccinate half its population by the end of this year. The key resources in Myanmar are split. The army has full access to and control of the country's vaccines, but the bulk of healthcare workers to mobilize and vaccinate people or simply to manage COVID-19 facilities refuse to work under military rule. Many have warned that healthcare and politics must be separated in order to effectively manage the pandemic. For now, neither the Myanmar army nor the ousted lawmakers are working together. On Thursday, a shadow government of ousted lawmakers said it set up its own COVID-19 task force. It'll focus on the ethnic areas, tapping the network of existing local healthcare groups there. The ousted lawmakers can also mobilize doctors currently on strike to support their plans. But the National Unity Government did not explain how it'll be able to secure and administer vaccine doses in Myanmar. And with no access to vaccines, there's only that much they can do. The key to linking both the political divide perhaps lies in neutral third parties, including aid groups operating in Myanmar.
The way we work is that we have confidential bilateral dialogues with, in certain countries, with the parties to a conflict. In Myanmar, of course, that includes the SAC, that includes the NUG. And the messages we pass there are indeed purely humanitarian.
There are, however, some doctors who are putting aside political differences.
The other day, I was called for, consultant for my specialization at the ED, emergency department. There are so many dead bodies in the emergency area, piling up. There are roughly, I must say, 20 or 25 bodies around that. But they are already dead when they arrive to the emergency, so you can, make your assumption how bad the situation is.
Both the Myanmar army and ousted lawmakers say they want to help Myanmar people amid this pandemic, but both sides have been slammed. People accuse the army of abusing power and mismanaging the health crisis. Sources also tell me the ousted lawmakers appear to be politicizing the pandemic to their advantage. But there is still one key group, Myanmar people, who are known to be resilient. Question is, can this resilience be applied effectively to overcome the COVID-19 pandemic? Young Wai-kit, CNA.